welcome to Guideline Central. My name is Dr. Tabitha Michaud, and today we'll be discussing the American College of Physicians, or the ACP's, new 2023 guidelines titled The Pharmacological Treatment of Primary Osteoporosis or Low Bone Mass to Prevent Fractures in Adults. Now, these guidelines were originally published in the ACP's main journal, the Annals of Internal Medicine, and you can find a link to the full text guideline on our website at guidelinescentral.com. Now, these guidelines are actually an update to the ACP's 2017 Pharmacological Treatment Recommendations and take into account emerging evidence on new treatments, the comparative effectiveness of treatments, and treatments for men, and is intended for all clinicians treating adults with primary osteoporosis or low bone mass, including pre- and postmenopausal women and men. Now, for this guideline, the ACP's Clinical Guidelines Committee has used the grade system for their recommendations, and that means that for each recommendation, you'll hear both a strength of recommendation grading of either strong or conditional, as well as a certainty of evidence grading of high, moderate, or low. And with that, we have 6 recommendations on pharmacological treatments from the ACP, so let's get into the guidelines. So our first recommendation from the ACP has 2 parts, but both are related to the recommendation that bisphosphonates be used as the initial pharmacological treatment to reduce the risk of fractures. So for Part 1A, the ACP gave a strong recommendation with a high certainty of evidence for the recommendation that clinicians use bisphosphonates as the initial pharmacological treatment for postmenopausal women diagnosed with primary osteoporosis to reduce the risk of fractures. And for Part 1B, the ACP also recommends that bisphosphonates be used as the initial pharmacological treatment for males diagnosed with primary osteoporosis to reduce the risk of fractures. This was given a conditional recommendation with low certainty of evidence. Our second recommendation from the ACP also has 2 parts. Both were given conditional recommendations, and here the ACP suggests that clinicians use a rank ligand inhibitor, denosumab, as a second-line pharmacological treatment for both postmenopausal women and males diagnosed with primary osteoporosis who either have a contraindication or experience adverse effects when taking bisphosphonates. For the postmenopausal women, this was a conditional recommendation with moderate certainty of evidence, and for males was given a conditional recommendation with low certainty of evidence. Our third recommendation from the ACP was also given a conditional recommendation, but do keep in mind that this recommendation is only intended for females with primary osteoporosis who are at very high risk of fracture. For this patient population, the ACP suggests that clinicians use either the sclerosterone inhibitor romosozumab followed by a bisphosphonate, or the recombinant PTH teriparatide followed by a bisphosphonate to reduce the risk of fracture. The suggested use of romosozumab followed by a bisphosphonate was given a moderate certainty of evidence and a conditional recommendation, where the use of teriparatide followed by a bisphosphonate was also a conditional recommendation, but with low certainty of evidence. Our fourth and final recommendation from the ACP is a conditional recommendation with low certainty of evidence, and here the ACP suggests that clinicians use an individualized approach regarding whether to start pharmacological treatment with bisphosphonates for females over the age of 65 with low bone mass or osteopenia to reduce their risk of fractures. And that wraps up the ACP's 2023 Pharmacological Treatment of Primary Osteoporosis or Low Bone Mass in Adults to Prevent Fractures recommendations. And you can find more information in the full text guideline, but there are a couple of clinical considerations that the ACP wants to include that we think we should mention, and those include clinicians should prescribe generics whenever possible. Healthy lifestyle modifications and adequate intake of vitamin D and calcium should be encouraged. Clinicians should assess for a baseline risk of fracture based on an individual assessment of bone mineral density, history of prior fractures, and things like response to prior osteoporosis treatments. Individualized approaches should be taken for decisions like bisphosphonate holidays and for adults who are greater than 65 who are at higher risk for falls and adverse events. For men and women who are at standard risk for fracture, bisphosphonate is the first-line therapy, and second-line treatment is with denosumab for patients who either had contraindications to bisphosphonates or adverse events. Now, if you're looking for more information about the ACP's recommendations, you can find the guideline summary as well as the link to the full text on our website at guidelinescentral.com. While you're there, make sure to check out our other osteoporosis-related guidelines, as well as our other quick reference guideline content from over 45 different medical societies, all available on our website. And that wraps up the ACP's 2023 guidelines on the pharmacological treatment of primary osteoporosis or low bone mass to prevent fractures in adults. Thanks for joining us today to talk about fracture prevention, and we'll see you guys on the next guideline.